Recording in progress.
Good morning. Good morning to all the members. Good morning to the support staff.
Morning, Chair.
Chair. Chairperson, morning all.
Morning, Chair.
Good morning. Thank you very much. I see the time is 10 o'clock, as the meeting being scheduled for 10 o'clock. Marcel, can you check the apologies? Let me check. Let's start with apologies. Just a roll call. Let's just make the roll call whether everybody's here.
Good morning again, Chairperson, members, Minister, Deputy Minister, our colleagues from the department, and all in the meeting. Chairperson, we have not received any apologies from our members, but we have received an apology from the Parliamentary Legal Advisor. Thank you, Chair.
Thank you very much. We are a quorum for these meetings, the Select Committee meeting of the National Council of Provinces, the Select Committee on Health, Social Services and Education. Once more, good morning to all the members. And also that let me use this opportunity to acknowledge the Honorable Minister, Honorable Deputy Minister, and also the National Department of Health, all stakeholders, to this meeting. It's a meeting that the purpose of this meeting is it's a postponed meeting of the 31st of October. We postponed the meeting to have it today, the 7th of November. And as we postponed the meeting, the reasons why we have postponed this meeting was that because the purpose of this meeting, first, let me re-emphasize that, is for the department to respond on submissions. And we postponed the meeting for all submissions to be accepted by the Secretariat of the Select Committee, and then that submissions to be captured and being sent to the department. In terms of the reason of the meeting for today is to make sure that all outstanding submissions are accepted by the Secretariat of the Select Committee, and that submissions are being captured, and the report to be sent to the department. So we are here today to again engage the department on the submissions submitted, captured, and sent to the department. So I first thought, let me bring that background of the meeting. Yeah, I think that is in terms of the background of the meeting. So we will, before we go to the department to give responses on what they have received, to just check with the members in terms of what was being received by the members. Is it in line with the committee resolution of the 31st of October? So that we know that when we move forward with the department, we know that everything that we wanted to be implemented by the solution is being implemented as per decision. Can I first have that from the members? Honorable Chamberlain?
Yeah, thanks a lot, Chair. We took a resolution in the last meeting that all presentations, all inputs that came from the public should be captured, including those that came outside of the closing hour of the committee. And we took this resolution that those things should be sent to the department and analyzed. But most unfortunately, all of them are not sent. So I suggest that maybe we deal with whatever we have and ensuring that in the next meeting, the secretariat of the select committee on the NHI will have captured everything and send it to the department for analysis, so that we do not end up delaying this process unnecessarily. That will be my suggestion, Chairperson, that we continue with what we have, but that ensure that we, in the next meeting, all else will have been sent to the department for the analysis. Yeah, and then unless if maybe maybe the secretary can tell us what has happened, and then we continue with the meeting. Particular thing like, will these things be captured? Is there some support that she needs in terms of capturing the documents? Because it can be quite hectic given the time. So yeah, if she needs a support, that we should give her that support for capturing. Thanks, Chairperson.
Thank you, Honorable Tabeleng. Honorable Nkosi.
Thank you very much, Chair. Greetings to your good self, the Minister and the Deputy Minister, and the Department of Health nationally, and our staff, my colleagues from the NCOP. Chair, probably before I support the proposal that has been made by Honorable Tabeleng, can we get a clarity exactly as to why it was not the resolution that was taken last week was not implemented as we have agreed? Because the intention for us to say let the meeting be postponed last week Tuesday and sit this week was because of the submissions that were not captured, and we agreed and we appealed that the submissions must be submitted must be captured, and the report must be submitted to the department, so that in our today's meeting we deal with all the report that it's going to be presented by the department. And it's very surprising that even today there are submissions that are not captured in the report, especially the Free State one, and secondly the report was not submitted today to the department. I find it very, very difficult to accept it, Chair, why it was not implemented, because the resolution of our last week Tuesday was very much clear to say what needs to happen the whole of last week so that we can discuss the report and finalize it today. Can we get that clarity? Probably after that I'll be able to continue with what I want to say. Thank you.
Thank you very much, Honorable Nkosi. I think we are very clear here in terms of the resolution that was taken by the Select Committee last week, 31st October. And as the chairperson of the committee, I'm very clear in terms of when decisions are taken by the committee, that the Secretariat must implement those decisions as is. I want to underline as is, because there were no confusion in the decision. The decision was, as we say, that all outstanding submissions must be accepted and must be captured and must be consolidated, must be sent to the department for analysis. That was the decision of the committee. I will appreciate if the secretary can give us that. Why was that not done?
Good morning again, Chairperson. Good morning, members. Chairperson, in terms of the late submissions, as per your directive, Tuesday after the meeting, all late submissions were sent to the legal advisors of the State Law Advisor, the Parliamentary Legal Advisor, the content team, as well as the department. I'm not sure, Chair, where it came about that those documents were not sent off. I've captured all of them and I've sent them all to the relevant departments that needed to deal with them, Chairperson. The report was compiled yesterday, Chair. It was shared with you, I think, through the manager. I just did not get a notification to send it to the department, but it was emailed to you yesterday, Chair. Maybe I'm confused, but The report was compiled yesterday by the content team, Chair. Thank you.
I think in terms of the processing, what was sent to me yesterday is not what was sent to the committee. Meaning that is saying that what was sent to me is not what was the department was supposed to respond on today, which was actual the purpose of this meeting, that those outstanding matters or submissions must be consolidated and being sent to the department, which was not done. So, Honorable Nkosi?
No, Chairperson, thank you very much. I had the explanation from the Secretary. Chair, I want to put it very clear in this meeting that we are being played here, and we are not going to allow that to happen. We are not playing, Chair. We can't do one and the same thing. We cannot do that. We will request that the support staff must give the support that is expected of them, because they are here to support us, not to sabotage us. But seemingly we are being sabotaged with this bill. We don't know what are their interests. Can we request that whatever decision or resolution that is being taken by this committee, it's supposed to be implemented? And I find it very strange, Chair, if today the Secretary will say she was not given an instruction to send the department, the report to the department. We are not dealing with the bills for the first time in this committee. We used to deal with the bills, and we never encounter such a problem like this one. That is why I'm saying we are being played, and we are not going to allow this to happen. We request this for the last time, that whatever resolution that you are taking, those resolutions must be implemented by our staff, and they must give the support that is necessary and is expected of them, not them being sabotaging us as this committee. I think we need to really take this matter very, very seriously, because since we have started with this bill, you can see that somehow there are people that are busy sabotaging us. And I wanted to put it very clear once more that we are not going to allow that to happen. We are going to pass this bill, whether they like it or not. We are going to pass this bill. Chair, on the report that was sent to you, one, I've indicated that the Free State submissions are not captured, which we would want to request that those submissions must be captured. I'm supporting the proposal that was made initially by Ntshabeleng that on Thursday we come back so that we can deal with this matter once and for all of the submissions. On the very same page of page 17, the capturing of the sentence that is saying the submissions were not taken due to the late submission of the late time. I think we need to correct that the submissions were not taken because it was not, they were late because of the closing time, not because it's going to be a problem for us if we are saying that the submissions were not submitted because of the late time. Let's say they were not taken because we submitted outside the closing time. We are appealing once more to the staff. Please give us the support that we necessarily need from you, not something else. I submit, Chair. Thank you.
Thank you, Honorable Nkosi, Honorable Ndongeni, then Honorable Baha. Then we'll move forward with this.
Thank you, Chair. I just support Comrade Nkosi, but let me correct the page. The page is not page 17, it's page 7. Otherwise, if our support have got a problem or not doing things on time. They must come back to us, say, I've got a problem of this and this, or I've got a challenge of this and this, so that we can see. We're not going to hear now from the meeting, but there's this submissions not yet submitted to the department. And I really don't know, and I'm not quite sure about what's going on really. But Chair, let not repeat what Honorable Gos have said. Thank you very much.
Honorable Baha, we will move forward after you.
Thank you, Chairperson. Chair, I'm with what the other members are saying in terms of not proceeding with this meeting until everything is captured. Secondly, just on a lighter note, this is not about, it's not about us confirming that we'll be passing the bill, but it says that all information must be captured so to get into a finality of the bill. So Chair, I want to support what is proposed. And I think that we must just commit that when we meet, everything will be finalized. No inputs must be left outside the process, because that might lead to us getting to a point of saying, because this and this was not met and this was not done and these were not captured, and therefore the process will be challenged probably legally. So I'm saying, Chairperson, let's do everything according to the book, so that we are in the clear when we get to the finalization of the actual bill. So I'm in support of what is being proposed, Chairperson, that let's in fact concretely, let's postpone again this meeting to a point where everything is captured, forwarded to the department being able to provide responses on such, so that we get to the finality of what we are supposed to do. Thank you, Chairperson.
Thanks.
Thank you very much, honorable members. Honorable members, I think we had to have this session that we clear the house, because we cannot have a situation where there are obstacles. So in clearing the process, we are clearing the process because we are representing the communities, and we must make sure that when we pass bills, we did everything that the law and the legislature is required from us as members of parliament. And we will do that. So we will stick to what legislature is saying. These are processes. This is how things must be done. These are legal. And we as the committee will process things as supposed to be processed. So, Honorable Chabaleng, I don't know whether you have another point, but I think we have exhausted this point. Then I would want to get to the process of from here to Thursday, what we do. Honorable Chabaleng?
No, I was going to say, yes, thanks, Chair. I was suggesting that to avoid this day and expenditure being wasteful, let the department respond to what they have, what they've already analyzed, and then present it to us, and then the rest will be given. We hope that the secretariat and then the team will be able to give them to the department on time for the last engagement on this chapter. On this, yeah. So I was suggesting that we continue with the presentation just to save the day, and then yeah.
Okay.
And we'll finalize it next week or
Not
whatever
next
day. Yeah, thanks.
Okay. Thank you very much, members. Let me then give a conclusion on what we have discussed. out of the discussion, it came clear that as this committee, I believe that are old hands, ne? Honorable Chabeleng and Honorable Nkosi, old hands. Because I'm trying to conclude on what we have
No.
discussed.
No, Chair, you can conclude. I wanted to correct one thing that Honorable Baka was saying, that we postponed the meeting. I think Honorable Chabeleng has covered me that we are not postponing it now, but we'll give it to the department to do the presentation and deal with the presentation of the department today. The other one, we are going to deal with it on Thursday. Thank you very much, Chair.
Thank you very much, members. Yes, in terms of that is crafting the way forward. Honorable Nkosi, you can take down your hand. And think of out of the discussions is that, and in terms of on the table of submissions, there's the outstanding information of the Free State that must be captured by the select committee and sent to the department with all other information. And then the wording of the late submission, because this committee have a resolution. We cannot speak of late submission. We say the resolution is that submission that was accepted outside the closing date. I think that's more administrative. Then then all those information will be sent to the department, and then the department will then prepare to respond to that information on Thursday. So for today, we will give the department to respond on what they have received. And that will be the meeting of today. Thank you very much. Then let me then say that welcome.
Just a correction, Chair. Just a correction, Chair. Not outside the date, outside the time.
Or closing time.
Yeah, after
Okay.
yeah.
Time. No, thank you very much. That's accepted.
Sorry, Chair. Just a small one. There is correspondence from the Western Cape that was sent to the chairperson of the NCOP. But I just want to raise that because I think Western Cape has also some issues in terms of submission, but we can talk about it outside of the meeting. But I just want to highlight that coupled with what is said about the Free State. Just for noting, Chair.
Yeah, I think on that point, Honorable Baha, it is not the same point. I'm aware of the letter. I will not respond to it now, but just to give the procedure of it, I'm aware of the letter from the Western Cape in terms of their capturing process in their province, which in terms of the roadmap, that matter is being addressed in terms of the roadmap. The roadmap is addressing to say today we are having a select committee where the department is responding. We are now saying process it to Thursday, that we'll finalize this process of the select committee in terms of the department responding, meaning Thursday will be done with the department. On the 14th, we will have negotiating mandates. On the 21st, we will have final mandates, and also we will adopt the report on the 21st. That is in terms of the roadmap. Then in terms of that, it is addressing the letter of the Western Cape that they wrote. I'm aware of the letter. Then the issue of the Free State was on the point that those submissions which was not accepted. So just also to clarify that. So then members on that note, we will then now give to the department, Honorable Minister, that the department will respond on what they have received after the 31st. And then after that, we will also excuse the department, and we'll then adopt our minutes of the previous. Or if not, we can also do that on Thursday. Then we know that we close our meeting once. I think the minutes will be adopted on Thursday. So we have all the minutes. Thank you, Honorable Minister, Department.
Thank you very much, Honorable Chairperson. Greetings to yourself and all the honorable members of the Select Committee on Health and Social Services. We are indeed pleased to have this opportunity again to come and present our responses to those additional written submissions which were given to us. We do understand that there will be some further submissions which will be forwarded to us for more responses. Let me upfront maybe just apologize on behalf of the Deputy Minister. He's going to have to leave. We also on the Tuesday do have a cabinet committee of the social sector, and there are a number of issues which health is also featuring in today's cabinet committee, which starts in the next 3 minutes. So we have arranged that I will stay in this meeting, and Deputy Minister Dr. Dlomo will join the cabinet committee. So just that apology. We have with us a team from the department led by Director General Dr. Buthelezi, and also our DDG in charge of the National Health Insurance, Professor Nicholas Crisp. I'm trying to, he is there as the co-host. Dr. Tulare, also our technical specialist, also responsible for the NHI. Again, as they will explain, the approach we have taken is to look at what has been submitted thus far, and we, as Chair has indicated, we will be getting some more matters which we need to process. We did get an indication that in this group of submissions which the team will be responding to, there are those which were just in support of the NHI without any other issues. So with those, we appreciate those submissions. So what will come now, it's those where either they supported but had particular questions, or some also who were not in support of the bill and have raised particular issues. So those are the issues which we will deal with. I believe that at the end, it will be the committee which will then make the decisions in terms of how to proceed. But from our side, we'll just again respond to where there are issues which have been raised. And as the team will indicate, just like we did last time, the approach was to again look at the clustering of matters where there's issues around questioning constitutionality or affordability or various clauses of the bill. The team has looked at that, and so they will not go into saying this matter relates to this organization or this individual or this grouping, but it will basically be focusing on the issues which arise from the various documents which were submitted to us. So that is the manner in which the matters will be addressed by the team. Similar, and we can also just indicate that there is also a lot of overlap with those which we dealt with last week. Some of the issues are coming back again, but the team will still deal with them as they arise from the batch which was received this time. I've checked with the DG earlier on, and he did confirm that Professor Nicholas Crisp will be the one who will lead us in terms of the presentation. And we will just add in if there's any matter which we feel that once he has done, that if anyone, either myself or other members of the team, including the DG, if there's any matter to add. Thank you very much. Chair, with your permission, I see Professor Crisp already has a co-hosting, so he should be able to flight his presentation. Thank you.
Thank you, Honorable Minister. Welcome, Department.
Thank you very much, Chair. Thank you, Minister, and thank you to all the members. I think the DM has probably gone already. Let me greet also the DG, all the honourable members and others present in the meeting. So as Minister has indicated, what we'll do is continue in the same vein as we did in the last meeting. So the purpose of this presentation is to provide the committee with updated responses to the additional 15 written submissions that the department received on the NHI bill, as was agreed at last week. There were also several thousand, as the Minister indicated, just as notes of support. We will also tabulate the exact numbers when we get everything from all of the provinces. So, Honourable Chair, honourable members, the department received these 15 additional written comments, and these submissions were again received from a diverse set of stakeholders, including medical schemes, professional associations, labour unions, pharmaceutical representative bodies, civil society formations or bodies, and from one provincial Department of Health, the Western Cape. Most of the comments raised have been responded to in previous responses by the department. So although there may be one or two overlaps, this presentation will focus on the remaining submissions that were not highlighted in previous presentations or that we have not responded to. So, Honourable Chair, we've out of those 15 submissions, we have identified 8 areas to comment on: the constitutionality of the bill, the role of the National Health Act and Medical Schemes Act vis-a-vis the bill, ministerial overreach, which has been noted as a problem by some respondents, the package of benefits, the role of provinces, an issue to do with one particular medical scheme, the NHI bill as a procurement bill, and the public health sector's challenges. So we're going to go through what we picked up as what was said and how we are responding. So, Honourable Chair, the constitutional issues that were raised in these 15 submissions were that the NHI violates a number of constitutional provisions, and what we specifically identified were comments that it violates rights of choice of users, professional autonomy, and the right to economic activity. So our response is that, in fact, as we said in the previous presentation, the NHI builds on the provisions of the Constitution, specifically Section 27 in the Bill of Rights. The NHI is intended to support the realization of every citizen's right to healthcare. Individual rights cannot override those of the greater good, and professional autonomy will still exist under the NHI, not as some people fear that it will not, as the NHI providers will choose to be accredited or contracted by the fund, and there are no limitations in the provisions of the bill around their professional autonomy. There's no economic activity that is specifically prohibited under NHI, so when the time comes, we are happy to engage with those who have this fear. In terms of the second set is that this is a matter that we have raised, has been raised with us before, and we have raised in the previous presentation. Some concerns were raised in these submissions about ministerial overreach, or specifically stated too much power is given to the Minister of Health in the structures and governance. Stakeholders specifically said that the minister has been allocated this power and has too much power to appoint or remove board members, and the bill allows the minister too much influence over the operations and functioning of the fund. So our response is, we must remember that the Minister of Health is the executive authority who is tasked by Section 92 of the Constitution, and also by Section 3 of the National Health Act, which comes subordinate to the Constitution, to be responsible for the health of the people of the country. And it is the minister who must ensure effective, equitable, and accessible healthcare to the entire population. This is outlined in some more detail in the National Health Act, but the Constitution requires that the executive authorities who report to the President and are part of the Cabinet are accountable for jointly and severally for the functions that the President allocates to them. So the powers that are indicated in this bill are intended to support this, not to usurp anybody's powers or to allow unfettered interference. And during the deliberations in the National Assembly's Portfolio Committee, the B bill was formulated, and it contains changes that accommodate mechanisms for stronger governance, with the minister needing approval of cabinet for appointments or removal of board members or to dissolve the board. Remembering also what we said in the last presentation, that all Schedule 3A public entities must still report to Parliament, even though they do report through a minister in the cabinet. Regarding the package of benefits, this has been also a repeated refrain, which we have responded to before, but it was raised again in these submissions. There are stakeholders who feel that the bill must clearly stipulate the list of services that would be covered by the fund. And they said, some said that the lack of details implies that the bill is misleading the public on exactly what they'll be entitled to under national health insurance. So our response is that the bill is an outline, and it outlines the framework that will apply in terms of institutional and organizational structures for the fund. Specifically, it creates advisory committees who will be constantly reviewing and refreshing benefits and benefits pricing. It outlines the principles in terms of the health entitlements that will be covered, and it does speak about comprehensiveness and covering the full continuum of care in more than one place. The exact details of what one covers by a fund, any fund, cannot be outlined in the founding acts and must rather be provided in regulations. And the reason for this is that it must allow flexibility around planning and proactively addressing the population needs and changes over time. Remembering that health technology advances rapidly. There are new drugs that are available, new technologies, new surgeries, new interventions. And so benefits do change over time. And as a new fund is created, one brings on benefits in a systematic fashion. So that has been our response from the beginning, and we still feel that it would not be reasonable to include all the benefits in the bill. They must be in the regulations. There were some complaints or issues raised by some respondents in these 15 submissions that stated the bill is a procurement bill and it restrains rather than promotes competition in the health sector. Specifically, stakeholders said that the bill appears to be a procurement bill outside of the public procurement bill, remembering that that is a bill still, it's not an act, it's not currently the law. And that the NHI bill excludes Competition Act from applying to the fund, which it does. And the NHI bill prohibits the provision of any service, which includes the goods that will form part of such service, such as medicine supply, outside of its formularies, in other words, essential medicine list-based, and outside of its approved protocols. And that the fund will procure on behalf of the private sector. So these were the stakeholders' concerns. So just to try and clarify that, our response is that the NHI bill is by no stretch of the imagination a procurement bill, but it does outline processes that will be implemented by the fund to exercise its strategic purchasing function to the benefit of the entire population. In fact, the National Department already does this to a certain extent under the National Health Act. The exemption from the Competition Act is based on the recognition that health is a public good and it should not be left to the whims of the market. And this has been outlined in the white paper long before the bill was written to support that paper. There's no provision in the bill that prohibits the provision of any service that falls outside of the formulary or the benefits, which some seem to think it does. and the NHI fund will not procure any benefits on behalf, any health products on behalf of either the public or the private sector. What the bill does is it provides for the fund to set and negotiate prices for health products that it includes in the formulary. And then all accredited and contracted providers may procure at those prices and those particular products. As I've just said, those products that are not in the formulary, anybody can continue to procure, but they won't be covered by the fund. The next set of challenges or issues that were raised is that the public sector is facing several challenges, and therefore the NHI should be postponed and not implemented until these are resolved. Stakeholders who had this view said that the public sector is currently facing several issues relating to infringement on constitutional rights and the provision of health services to the public, that access to healthcare remains a particular concern for women living in rural areas. The number of designated healthcare facilities in rural areas has historically been limited, and the bill does not address many of the current systemic problems currently existing in the public health sector. This means that there's a risk of repeating the same issues under the system of national health insurance, which the bill seeks to address. Now, in our response, the implementation of NHI is not an event that happens at one point. It's based on a structured, phased approach that incorporates the creation of the NHI fund as a strategic purchaser of healthcare services. And it's also supplemented by several provisions that address health system strengthening requirements to address systemic shortfalls. This is very specifically stated in section 57, which refers to phases 1 and 2, and which outline clearly that health system strengthening must continue in those two periods. The government remains invested in improving the public health system through additional models of funding to improve infrastructure, and very specifically, the Minister of Health, together with the Minister of Finance, together with the departments, that's Health and Treasury, are busy in advanced stages of looking at blended financing models to quicken the pace of quality improvement, particularly for infrastructure and the large equipment that is needed to support the public service delivery. The approach to implementing the NHI is not based on a prerequisites model, where certain things must be achieved prior to instituting NHI reforms. Instead, the way it's written and the intention is that the reforms are planned and implemented in parallel to ensure that both the strategic purchasing function is strengthened while at the same time addressing the key health systems issues affecting quality, access, and affordability. And as we've said in the National Assembly, the resources that are available to the country sit in both public and private sectors, and the way in which they are managed simultaneously is critical to the implementation over time of what is intended in this bill. There were some medical scheme nuances that were raised in these 15 submissions. We have addressed some of them before, but there was one closed public sector scheme contesting inclusion of their members in the NHI. This is a matter that has been presented several times in Cabinet, and we have noted in our responses to the questions that the Minister's been asked, that the only exclusions are the military and the State Security Agency. And this is because in the military, the South African Military Health Services has health establishments, 3 hospitals and many sick bays and clinics. And the military has its own permanent medical personnel and health service infrastructure, very significant infrastructure. By the way, it employs more than 400 doctors. The military also operates in several health institutes. There are at least 4 operational at the moment, and they provide health services outside of South Africa as they move in and out of operational areas. There's no other similar situation that exists where a separate public funder and provider is delivering services in the country. So we have responded directly, and the Honourable Minister has been, and our DG have been in contact with the relevant parties. This is the last slide, Chair. There were a number of additional concerns that were raised in passing. Some of them suggested to us that people are not familiar with terms. So, for instance, there were respondents who made comments about central hospitals. Just to clarify that there are 10 central hospitals. These hospitals are determined in terms of provisions in the National Health Act and regulations that are currently published and have been operational for many years already. That's not to say they can't be recategorized, but the Health Act provides for those hospitals to have a very specific function. In the stakeholders' positions, there was a suggestion made, but perhaps not clearly, that this might include a whole lot of private hospitals. That is not the case. There were also comments related to health technology assessment, and the way in which they were stated in these 15 presentations was a little unclear. But just to be clear, health technology assessment is outlined in the bill.
Because they're not sorting out issues of my payment.
Dr. Maloko?
It's not yet sorted.
Hello,
Dr.
Doc.
Maloko?
Hello, Doc Maloko.
Okay, thank you.
My sincere apologies.
Thank
Okay.
you. I'm almost done, Chair. So health technology assessment is a specific process that is used around the world to ensure that as new technologies become available, that includes medicines and devices and diagnostics and the way we provide care, that we incorporate those new technologies into the way that we provide healthcare and therefore into the benefits and the way we pay for the benefits. The way that it was commented on suggested that some respondents did not see it in that way. There were comments across the board of people wanting to see a lot of detail in the Act, and the issue of user registration was not understood well. There were some comments anticipating long waiting times, and several concerns were raised about anticipated job losses. So our response to these, Chair, is that one must remember that the National Health Act and the Medical Schemes Act are not being repealed even once this bill becomes an act. Those acts remain in place and have limited amendments to them. They still cover the functions that are outlined in both those pieces of legislation, and therefore will control for instance, the categorization or classification of hospitals within that piece of legislation. The National Health Insurance, once it's an act, will provide a framework, but it requires regulations. Even if one reads that National Health Act as it stands without regulations, there would be virtually nothing that you can do without the regulations. And we have repeatedly stated that too much detail in an act makes it not an act anymore, but a guideline, and it loses its longevity if one puts too much detail into the act itself. So we have resisted that call, but would like to make sure that the regulations, as they are published and as the act becomes an act and the president signs the various sections of the act into law, that the regulations make sense to everybody. Specifically on user registration, there was one submission which anticipated long waiting periods of up to 6 months, I guess with a similar anticipation of what people see in the current medical schemes environment. But this is not what's envisaged either in the bill or in the white paper. And in fact, the process that is envisaged is very similar to what happened during COVID-19 when people went to register for their vaccination jab. You are registered, boom, right there and then. You could in those days pre-register or register at the point of service. But once you are registered that first time, you are immediately a user of the system, and then your record will be portable around the rest of the health system. That is the intention and the way in which the registration system is currently designed and has in fact already been implemented during COVID. There was a concern in one submission in particular, but others have raised it sort of on the side, that the provincial departments of health will be made redundant. In fact, they won't be made redundant. It is true that over time there'll be alignment, and that's envisaged in this bill, with the proposed decentralization of functions to, for instance, districts and to hospitals to allow greater managerial autonomy. That is clearly spelled out in the bill. And that would mean that some public employees within specific offices around the public service may need to relocate. But that will not happen in the short term, and provisions of the Labour Relations Act will apply when the time arises. We do envisage we will need all the skills that we possibly can get. And in fact, we will need the skills that are currently in the private sector as well to successfully manage the national health insurance. So our concluding remarks from the department, Honourable Chair, and recognizing that there may still be a couple more comments or the report we haven't seen, we think we've now seen all the individual documents, is that the NHI bill provides a framework, and this framework definitely requires regulations. Not every single detail can be outlined and incorporated into a founding act, and in fact, that would be counterproductive. And we reiterate that the National Health Act and the Medical Schemes Act, along with the many other pieces of legislation that are administered by the Minister and the National Department, are not repealed by the NHI bill, and they will still cover their functions. Thank you, Chair.
Thank you very much. Thanks, Prof. Thank you very much, Chair. Chair, I think as you indicated in the beginning, in terms of the need for further engagement, the one thing which maybe as you come back, you could also just clarify in terms of the reports relating to the public hearings. We don't have any sort of comprehensive report of in terms of each province to say these are the matters arising from public hearings. From the mandates reports which have been shared with us, in some of those mandates reports, there's some issues which prop up, which says there's need for clarity on ABCD. Some of those do attempt to also give some indication of issues which arose even in different districts, but there's no uniformity. So I think as we, because I believe that whether it's, I think you talked about Thursday, from your program, as you outlined, it clearly looks like, I mean, that will be the final engagement with us from the department. I think we will just need to get some clarity as to how we deal with that part, whether we would then rely on what we have been copied as sort of, some of them, although they are put as the mandates from the province, but then they some also then outline various matters which need some clarification. But so as I say, it differs from one submission to the other. So that we may just need assistance as to how we were expected, and we're saying so because we know that these are two different houses. When we dealt with the public hearings in the Assembly, in the National Assembly, there was an assistance from the staff, from the support team from the Assembly to actually identify, put together all the issues which arose from the public hearings. So when we were responding, they had been compiled, but I know that the two houses are not necessarily the same. So we may just need clarity on that. Just on that point, I can just flag one particular matter, which we will come back to that as well. It was, I think it's the only unique one where while in other provinces, whatever we're getting is through the legislature, there was also a kind of an intervention from the MEC of Western Cape, amongst others, raising a matter to say that the bill was not approved by the National Health Council. Now, the National Health Council, it's the structure which ordinarily in many other, there's different names in different portfolios, but ordinarily it's also called a MINMEC. So because it is also described in the National Health Act, and in the National Health Act it is called a National Health Council. So that's what that's the name which is used. Now, just to say that, in terms of just quickly just responding to that matter, to say that we're actually quite surprised that the MEC of the health in the Western Cape can make that kind of an assertion, because what the National Health Act prescribes is that when there is a policy proposal, the minister should present it to the National Health Council so that the National Health Council can advise the minister on any matter which is got to do with policy. Now, this bill has been presented at National Health Councils on several occasions, but it also she also assumed that that has to be done before a bill is presented even to cabinet. Now, that can't happen because the minister is only empowered to actually consult once cabinet has approved that such a bill should actually be processed. Once the cabinet is approved, then the minister can consult before even going to parliament, before the bill is submitted to parliament. In fact, it's a matter which we've just been also processing at cabinet in terms of time, the time it takes, because currently you go to cabinet, if cabinet approves, you can then publish and consult, even you can even publish in the Gazette for comments before you come back to cabinet and then go to parliament. And we're trying to also streamline that in terms of the process. But there is no all that the National Health Act says is that before the minister takes a policy to parliament, it must have been presented and NHC must have had a chance to advise the minister on such a policy. And that has definitely been done. There is no requirement that the NHC, which is basically a structure which advises the minister, actually has to approve, because that would then give the NHC an executive power. There is no such a legislation which gives the NHC executive power. So I just wanted to just allude to that it's one of the few. In fact, it's the only situation where, over and above what we are getting from the legislatures, then there is also an intervention by a member of the executive. But we will formally also just deal with that. But I just wanted to inform the members that we did receive such, but we found it unfortunate because it's actually quite a misinterpretation of what the National Health Act provides in terms of consultation of the minister to the National Health Council. So let me leave it there, Chair. I think basically we're done. We'll await your guidance in terms of the final interaction with yourselves, as you mentioned that it probably will be on Thursday, in terms of what would need to be covered there, including how we then deal with any inputs which came from the public hearings. Thank you very much. Back to you, Honorable Chairperson.
Thank you very much, Honorable. Thank you very much, Honorable Minister. Thank you very much to department. Very comprehensive response. I will then now give an opportunity for the members. Is there anything from the members? Are there anything? Anything from the members? I can't see any hands. If okay, Honorable Christians. Honorable Christians, you may come in.
Thank you, Chairperson. Chairperson, I just want clarity. Professor Chris has mentioned that some of the stakeholders had mentioned that there is a concern about the detail not being adequate in the bill. And we understand the explanation given around that. However, my question is, just for clarity's sake then, is how will the department ensure that there is meaningful public engagement and transparency in the development and implementation of NHI policies and regulations in light of the concern that has been raised by many stakeholders? And then also, can the department provide details on how stakeholders, including the public, will be informed and included in these decision-making processes? Because I think that was one of the things that was a huge concern that has come up multiple times. So perhaps just provide clarity. I apologize if it was handled in the past, but perhaps it was raised again, if it can just be clarified. And then with regard to accrediting healthcare providers, on how we will ensure that quality and accessibility is upholded, or that specific criteria, how will we ensure it? And then also, can the department elaborate on how professional councils will continue to regulate the scope and ethics of healthcare professions under the NHI? And then lastly, what measures are then in place to address the concern that the South African economy might not be able to afford the NHI, especially given the current economic challenges? Thank you very much, Chairperson.
Thank you very much, Honorable Christians. Honorable Jabeling.
Yeah, thanks, Chair. My comment is going to be on the matters related to the amendment to the laws governing medical aid, that there's not going to be major changes to those, and that medical aid and private companies will still continue to exist under the NHI. And from my little experience or little interaction with the NHI when we visited Korea on a study tour, was that they passed the law in 1968, I think so. But the implementation happened very late, I think after about 15 years or so. And that our thrust as South Africa now is to say, we passed the law, and then what happens is that the implementation will be gradual, as we build the infrastructure. Now, I want to check, is there really reason for concern by anyone who thinks that this will affect the economy? How? Because according to me, it's not going to change anything in terms of affecting private businesses to operate. Or am I missing something on that one? Thank you, Chair.
Thank you very much, Honorable Jabeling. Any further members? Anything from the members? Okay. Let's then proceed to give the department to respond on that.
Thank you, Chair. Thank you. Professor Crisp will come back. My comment just on two issues. One, but still, even I'm just giving a preliminary comments, but Professor Crisp will again come back. Just Honorable Christians, in terms of, as Professor Crisp mentioned, that the details or in terms of package and various details of implementation come in as regulations are passed, and as clauses of the Act also get proclaimed. Now, when that happens, especially the regulations, because the proclamation also of sections also goes hand in hand with regulations. The National Health Act is quite specific also on the passing of regulations. There's a process. Members would remember we applied those processes from time to time when there has been outbreaks of diseases, just especially in the COVID, when we stopped using the disaster management regulations. And the procedure, as members would remember, is that before regulations can be promulgated, they have to be gazetted for public comment. And that period is prescribed. It's a 90-day period of comment, which is prescribed by the Act. So there is no way in which regulations which will be in relation to various clauses of the National Health Insurance Bill when it becomes an Act. There is no way that those regulations can be proclaimed or can actually be proclaimed, yes, without having been published openly for comment. And those comments is required that the minister and the department should apply their mind in terms of comments which come during the public commentary phase. So that is catered for in our regulation. I'll get Prof to come back. Honorable Chavelin, just I think as much as Professor Chris said that the Medical Schemes Act remains in place, is not being repealed, but in terms of scope, the National Health Insurance Bill does provide certain changes in terms of stating that when the National Health Insurance Fund is fully operational, private medical schemes will be allowed only to cover complementary services, health services. In other words, those services which will not be covered by the NHI. In other words, gradually, but this gradual, I don't think we're envisaging. I think as Dr. Chris mentioned, section, I think it's 57, does give some kind of time frames of two stages of preparatory and then full operation, and then strengthening beyond that. So because this is a reform which is quite urgently required, it is not envisaged that it will just take an unnecessarily long period of time to implement these two stages, which is looking at, I think the first one about 3 years and the other one another 3 years, but going forward continue to make improvements. So there will be some elements of what is the business of private health will be affected in as far as the broad scale of medical private cover, private insurance, as in the current medical schemes scope of coverage. That will change. So I think that's something which otherwise there will be no need to even promulgate a bill of this nature if we wanted to leave the status quo as it is. So there will be change. It will not be an event, as Prof. Crisp said. It will be a process, and which will be step by step. But also, even in terms of on the provider side, one of the things which will definitely change is in terms of the way in which currently, with the multiple funds, providers are able to just call for various services, any amount of payments, and and they hold the funders in a way at ransom. So this is on the provider side. What this will also bring in line, it's a more regulated, cost of providing services. In other words, purchasing services from private providers. It will not just, if you're going to be a provider who is into an agreement with the fund to reimburse your services, it will be in terms of what we call the current business of health, it will be completely different in the sense that the fund will be, of course, will negotiate certain costs of reimbursements, but once that is done, it will be like that. You won't have the kind of situation today where your private providers can just call an arm and a leg for whatever services they have provided. There will still be, there will be no disallowing or making unlawful any practice in terms of provision of private services. But if you're going to be accredited and contracted to be a provider who's reimbursed by the fund, then you have to play by particular rules, which at the current moment is almost like a free for all, which leads to the current escalation of costs. But let me leave the rest to Professor Crisp just to take us through the few matters which have been raised. Over to you, Prof.
Thank you very much, Minister, and thanks, Chair. Minister's actually covered pretty well, so maybe just a few details and examples to add to what the Honourable Minister said. So Honourable Christians asked about how will we ensure consultation, and the Ministers referred to the process of making regulations, which, as is stated in the National Health Act, it's the same provisions in the NHI bill. Section 55(2) requires a 3-month period. So Minister spoke about 90 days. So it's the 3-month period for consultation when any regulations are published. And that would be any changes in regulations as well have to be published for public comment. And then there's a period of incorporating those changes before they can come into effect. And this must be read, especially in the initial period, together with Section 59, subsection 2, which is right at the end of the bill, which provides that the President can bring different sections of this legislation into law on different dates. That's done very deliberately, particularly at the startup, to ensure that we don't give a whole lot of functions to a new entity that has no capabilities. So one needs to, in a way, read these different provisions together to see how the initial period will go. So what we do envisage now in the next 6 to 9 months is that the fund does not exist. It has no board. It has no governance structures. It has no fund. It has no budget. It has nothing. It doesn't exist. At the moment, what we have is the branch that, as the Minister said, I head in the National Department, and we are doing the thinking and preparation work for the establishment of this scheduled entity. So what we envisage will happen is that when the bill is enacted, the President will bring into law those clauses which will enable us to comply with the first set of transitional provisions. That's in Section 57. And those first 3-year period, which Minister also referred to, is from 2023 now till 2026, 3-year period, which will enable the appointment of a board committees, other what we call governance structures. So we are in the process, as the unit within the Department of Health, drafting what we are loosely terming governance regulations, which we can't publish until there's an act. What those will do, for instance, and I'm just giving some examples, The bill requires that the minister must appoint an ad hoc committee, but it doesn't say how or who will be on the ad hoc committee. That also requires that individuals of the public can be nominated. Which individuals? Who may nominate? When do they nominate? In what format? Who's a fit and proper person? So all of those are details that we will put into these governance regulations. And because this is the foundation of the entire setting up of a new entity, we envisage that that consultation process will run the full 3 months and perhaps have further discussions outside of it. Only once that has happened is it possible for monies to be moved under the control of a board. The board needs to get a vice chairperson, needs to appoint a CEO, to put administration in place. Those steps are all going to take time. So I think it's important for those who are concerned to go back to those clauses in the bill and see how they relate to one another, especially at the outset. Of course, we believe and hope that when we draft and approve a piece of legislation, that it will live for a long time. And that long time, the Health Act has been in place since 2003, and there are still 4 or 5 clauses that have not been brought into law, and in fact are subject of quite a lot of debate and even in the courts. So it does happen, and that is what we envisage we will be dealing with going forward. So the question is, and I guess Honourable Minister did allude to this as well, the economy, and Honourable Chabileng also mentioned, the economy is not envisaged to be static for the next 3, 5, 6, 10 years, however long it takes to move forward. But it will dictate the pace at which some of the changes can happen, and some of the shifting of funds can take place to capitalize and get this new entity running. But the question of whether we can afford it or not, we cannot afford not to change, because the current way in which we have structured this very complicated system is depleting resources, it's extremely duplicative, and it is undermining our ability to deliver services. Honourable Christians asked about professional councils. In the health department, and I'm talking about our national department, but I'm sure I can speak on behalf of the provincial departments, we are jealously protective of our professional councils. As health practitioners, that is what makes us who we are. And so we are very wary of interfering or intervening on anything that has to do with the professional councils. So there are several of these councils, and what we envisage happening is that they will continue to be autonomous, but that the fund will be able to exchange data so that the fund is aware that when somebody is registered or a registration changes or somebody is suspended, we are immediately aware that this person is not authorized to practice as a practitioner. And whether that is the Health Professionals Council or the Nursing Council or otherwise, that is what we envisage happening. Quality is mentioned 39 times in the bill, including the sections at the end. It is a fundamental part of what the NHI strives to achieve. But quality is not something that happens just on its own. Anybody knows that if you want to improve quality, you have to have deliberate quality improvement strategies, and the national and provincial departments of health must ensure, irrespective of what the fund does, that those quality improvements are in place. What the fund will do, according to what's in the bill, is sanction people where quality is unacceptable. And there are ways to do it. The bill describes that the fund may de-accredit a provider. There are conditions, again, under which that would happen, and they would be elaborated on in regulations. But for instance, if a provider is unsafe or unsavory for whatever's in the regulations purposes, the fund would be at liberty to de-accredit that provider. So again, this is a process, and there needs to be time given. Like the environmental health officers do now when they go to a restaurant, they will give them warning if they find something wrong. get 30 days to fix this, or 7 days to fix that, or 3 months to fix something else. We will need to regulate what those conditions are for ensuring that there's quality. But the power is that if you control the payments to providers, you are able to ensure that they meet those quality standards. Honorable Ntshabileng referred to one country, Korea, and the long path that they went through. Between myself and our team, we have had the privilege of visiting many countries, some of whom have had very successful transitions into various forms of either national health insurance as single payer systems or more complex systems. And we have been able to take from many of these examples of what we think will work in our transition and into our national health insurance. So although our transition will be gradual and others have taken many years, there are many things that we can change in the short term. And I think the Honourable Minister referred to that. We do need to get control of the runaway costs. We do need to make sure that we get stabilized equity in access to services. And there are a whole lot of other things that are outlined one for one in the bill that we will put into more detailed regulations, that as soon as there's a board, because remember, it's a board that will be making these decisions, notwithstanding the fact that they will be reporting to the Minister, to Cabinet, and to Parliament. So it's very important that the next founding period, the next 12 months after the promulgation of this, the assent and promulgation of this legislation comes into place. Minister, I think I'll leave it at that, and thank you very much for letting me respond.
Thank you very much, Prof. Honorable Chair, we're done with what had been raised. So back to you. Thank you very much.
Thank you very much, Honorable Minister, and thank you very much, Prof. I think from where I'm sitting, it's very nice to listen to you because of the clear articulation that you are making in terms of when you are explaining. So for the ordinary person or the layman in the street to understand. So I really want to compliment that you giving a detailed, clear responses. So we want to thank the Minister, Honorable Minister. Just before we go make our closing, let me give to the whip, Honorable Nkosi.
Thank you very much, Honorable Chair. I would like to thank the department and the Minister for the detailed presentation and the responses that they've made today in our meeting, Chair. And would love to welcome their presentation, taking into consideration that the corrections that were made previously before we start our meeting will be considered. One of the Free State submissions that is said to be no submissions submitted by Free State and are going to be captured and dealt with on our next meeting on Thursday. And the other one, the correction of the wording in the report that says late submissions instead of to say submissions submitted outside the closing time. So we would like to welcome that report with those amendments. Thank you very much, Chair. In closing, Chair, I would love to request our support staff that please make sure that the resolution taken today for the capturing of this Free State submissions, it's done, and the report is submitted or sent to the Department of Health so that they can get enough time to prepare their responses for the Thursday meeting. We don't want to get the surprises on Thursday We don't want any excuses on Thursday. Please, Chair, that is my closing comments for this meeting. But thank you very well, Minister, in your team. Thank you, Chair.
Thank you, Honorable Nkosi. Yes, those are in terms of remarks in terms of our decisions that we have taken for this meeting. I will actually put more emphasis to say that the submissions must be submitted today to the department. So I will follow up on that after this meeting, but it must be sent to the department today so that we are ready for Thursday, which I believe they will not have such a long meeting, that the department to respond on those submissions were still outstanding, holistic. Then the closing on this meeting is just again to make emphasis on the roadmap, that the roadmap after Thursday actually we are closing this session on Thursday. We'll be final with this session of engaging the department on responses. Then on the 14th of November, which all provinces have been given ample time to consolidate their submissions, and that they will provide and present their negotiating mandates to the committee on the 14th of November. Then on the 21st of November, all provinces will present their final mandates, and the select committee adopt this report, so that we again understand as how we are going to move forward. And I once more want to thank the Honorable Minister, the department, the members, and to say that thank you very much for this meeting, and that we believe that we will work together and to make sure that we finish our work in time, and then that we serve the community with all our ability. On that note, then to stand that this meeting is adjourned. Thank you very much.
Thank you very much, Chair.
Thank you.
Thank you
sir.
very much, Chairperson.
Thank you, Chair.
Thank you so much.
Thank you.
The
Thank
roadmap
you
is
very
clear.
much.
We are very,
Thank
very
you.
much clear about it.
Yeah.
Thank you so much.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you. Thank you. Have a great day.